Medcoff from Farhang Medcoff on behalf of the Tucson Metro Chamber, here to talk to you today about the coronavirus and what we know now and what you as employers can think about to try to deal with the uncharted waters, this unprecedented situation that we're facing. I'm not going to spend time going over the basics of coronavirus, how it started, how the virus has passed from person to person, or anything like that. Instead, I'm going to focus on things related to what to do if an employee comes to you and says that I feel ill. What should I do as an employer to advise that employee to keep the work staff safe, as well as customers that you may service safe. With respect to this issue, obviously it's a changing environment. What I'm talking about now may be different an hour from now, tomorrow, next week. Obviously, the government is responding as quickly and as best they can to the situation. But some of these things I think will continue to be relevant for you and your business. So if an employee approaches you and says, hey, I feel sick, what should I as an employer do? So the first thing that I've been advising clients, people, members of the chamber, etc., is you need to tell your employees to stay home if they're ill. Because what may seem like a common cold or the flu may actually be the coronavirus. The differentiations in terms of the symptoms are very similar. Some of the differences with the coronavirus is it typically deals with shortness of breath. That's a major difference. The symptoms typically appear 2 to 5 days. Typically is when they start getting more prevalent and worse. It's important that when somebody says, an employee calls you and says, I'm sick, that you have them stay home so that they can recover, and if they get worse, that they can seek medical care or attention. In terms of seeking medical care and attention, typically the experts are saying in 80 to 85% of any exposure, even to coronavirus, people are going to get well on their own just with rest. And 10 to 14%, they may need to seek medical care of some kind, and in 5%, the person that contracts the virus may need to go to the hospital. But obviously, if your symptoms get worse when you're self-quarantined at home, then that employee should contact their primary care physician. They should call that primary care physician before they just show up at a doctor's office. Definitely don't go to hospitals because they may not have test kits or they may not be equipped to triage or assist you. So definitely call your primary care physician first. That's what all the hospitals and other healthcare providers are being told to recommend to patients. In addition, if you have questions, you can call the Arizona Poison Control at 1-800-222-1222. You can also call the Pima County Health Department for updates at 520-626-6016. Now, it may seem strange to call Arizona Poison Control for updates, but they've actually been contracted by the Arizona Department of Health Services to assist and handle calls related to COVID-19 and the coronavirus. So definitely use those as resources. Additional resources are the CDC online. They have lots of really good, helpful information for employers and individuals for how to protect yourself at home and otherwise. Another resource is pima.gov/COVID-19. There's lots of updated information there. Just so you know, there's lots of people that are wondering what's real information, what's accurate, what's not accurate. Those resources, pima.gov/COVID-19, the CDC, are your best resources for information because they are updated repeatedly and often so that you get good information. Right now, there are 4 confirmed cases in Pima County. There's basically been about 183 people or so that have been tested in the state of Arizona, about 15 positive tests in the state right now. So the risk of contracting COVID-19 continues to be low in the state of Arizona, but obviously it's important to take steps for the greater good for not only your business, your customers, but those that you may interact with, because you may be a transmitter unbeknownst to you, because again, you may think you have a cold, or it may feel like allergies, but it could be something more than that. So just wanted to provide that background to you as employers. So let's talk about what you should do as an employer to help prepare yourself, maybe ease the fears of your employees or ease the fears of your customers. So first thing that I've been talking to clients about is it's important to circulate notices to your employees and your customer base about what you are doing to protect your customers as well as your employees. And obviously, what notice you give your customers and your employees is going to depend on what sort of business you run. Obviously, a restaurant is going to want to publish different things than, for instance, a manufacturing business. But it's important as business leaders to keep your emotions in check. Employees look to their bosses for direction and support, so you need to set a good tone for your team. It's important to remain calm. Obviously, fears and panic is occurring left and right now. So it's important just to make sure that you provide accurate information to your employees, which is why it's good to go to those government resources that are provided to you so that you can make sure that you are providing accurate information to your employees as well as your customers. And then you need to have a plan that you can publish to your employees as well as your customers about what you have done and will continue to do to be prepared and respond and adjust as things change and as the virus spreads. So you need to adjust your plan as circumstances change. You need to have established policies that encourage employees to work safely and smartly. You need to talk to your team, encourage empathy. You need to listen to your team and what fears or anxiety they might be experiencing so that you can build trust with them, and then provide a foundation of support for them, and then obviously adjust your plan based on what your team is telling you. Along those lines, you want to empower your team, allow your team to share, for instance, paid time off. If you've got personal time off, a PTO policy, and somebody's got a bunch of bank time, this would be a great time to empower your team to share that PTO with other employees if they so wish. If the team requests time off or to run a negative PTO balance and it doesn't pose a hardship for you as a business, you can choose to allow a negative balance on these uncharted times, but you should explain to employees that they must repay the negative balance if they quit or let go before they accrue the personal time off to fill their bank. So you want to have employees sign what's called a payroll deduction authorization that allows you as an employer to apply the negative PTO balance against the employee's final paycheck if they quit or are let go before they accrue that negative balance. Of course, there may be some federal government funds available that Congress has passed. The House of Reps has passed a paid sick time for smaller employers for less than 500 employees. If it's more than 500, the business is exempt and it doesn't apply. But for a lot of Tucson employers, that federal law, if it's passed by the Senate later this afternoon, would provide up to 2 weeks of sick time that could then be used by the employer to replenish any negative balance that the employees may have utilized. In addition, as employers, you may want to take a look at whether telecommuting is an option for your business. Can you still get the work done that you need to for your clients, whether that's as a service provider or a manufacturer? So you need to talk to your IT department to see if it's even feasible to do telecommuting. If it is, then you need to make sure that you have the number of licenses to allow your employees to work in their home offices if they have them. You also want to check with your insurance agents to make sure from a workers' comp standpoint that you're covered if somebody gets hurt while they're working in their home. You want to talk to your team about dressing as if they're going to work, because then they'll potentially be more productive when they're working in their home offices. You also want to reassure your clients, if you're going to allow teleworking or provide telecommuting to your employees, that you explain what that means to your clients and how their information is going to be protected, how your services are going to be delivered, how the manufacturing process is still going to work in the event that you do decide to do teleworking. It's going to be important to consult with your attorneys on your policies to make sure they're uniformly and fairly administered. So teleworking definitely is an option if it works for your business. Another option that as employers that you may want to consider are staggered work shifts. So, for instance, if you normally are open 9 to 5 or 8 to 5, maybe you operate from two shifts from 7 a.m. to 1 p.m. and 1 p.m. to 7 p.m., for instance, so that you have two 6-hour shifts. And obviously that means some of your workers may be working less than an 8-hour workday, but if they have accrued PTO, then they can utilize that to be paid a full work period. Alternatively, if the government does pass the paid sick leave for the 2 weeks, then that might help. If you have employees that have kids at home, then they could stagger that where one person could watch the kids during the morning shift, and then the afternoon they could swap. So that way young kids or parents with young kids would have some coverage so they don't have to worry about their young kids being left home alone. Another option to consider are reduced hours, reducing shifts for your part-time employees or moving full-timers to part-timers. Furloughs, potentially layoffs. Anytime you do layoffs or furloughs, however, you may have unemployment benefits that you need to pay, which could potentially increase your ratings for your business and increase your payroll taxes down the road. To me, reduced hours obviously is an option, but you need to definitely talk to your attorney about what this means for your business. If you do want to explore that option, you need to obviously have open lines of communications with your employees why you're doing this, that it's requiring a sacrifice from everybody in order to keep everybody employed as opposed to having to lay some people off. So definitely the reduced hours is another option. Some other considerations to think about is whether you can do meetings with clients or other meetings with your employees via video conferencing or telephone meetings instead of in person to reduce the social distancing that a lot of governments are encouraging. Clients and employees may appreciate those protective measures if they're feasible for your business. You should look at being prepared for possible increases in absenteeism for your employees, especially now that schools are being closed in the state of Arizona. People with young kids probably cannot afford to leave them at home or can't afford daycare, so they may have to take some time off from work to deal with that. So things to consider is what are the essential business functions that you need in order to provide your service or products to your clients? How do you continue to provide those essential functions when you're experiencing high absenteeism? You may want to look at cross-training employees to do other jobs in case of absences. And then you may need to adjust your business practices to maintain critical operations. For instance, alternative suppliers, prioritizing clients, temporarily suspending maybe less profitable operations, things of that nature. Some of the questions that we got before the presentation, and if you do have questions, feel free to send them to me. Be happy to look at them and answer them at the end of my presentation. So PTO, if accrued, employees can use them as they deem necessary, subject to business needs and whatever written policies that you may have. So simply because you have PTO, you may have it segregated into personal time off versus vacation time versus sick time. So you need to look at your policies and implement and enforce them uniformly and consistently. If you need to change your policies, you may be able to do that depending on what your handbook or your written policies say. A lot of policies give discretion to the employer to adjust those policies as needed and as business needs dictate. Leave of absences, again, these are going to be dependent on your written policies and your handbook. If you have one, it's not necessarily required, a required benefit that employers have to have. The exception would be if the Americans with Disability Act applies. Leave of absence may be a required accommodation that you may need to provide to an employee who has a disability and otherwise qualifies for protection under the ADA, assuming it doesn't create a hardship for your business. Other things, if somebody is calling in sick and they've got paid sick time under the Arizona law, Prop 206, then you as an employer can't ask for backup documents until the employee's been out for 3 or more days. However, if they call in and say they're out sick, then you should ask them, is this paid sick time under Arizona law, so you can note that in your file. The Family Medical Leave Act may or may not apply depending on whether you have 50 or more employees within a 75-mile radius. In addition, your employee needs to have worked for you for at least a year, although it doesn't need to be continuous, and they have to have worked 1,250 hours within the prior 12 months. So if you meet those criteria and your employees meet those criteria, then there may be some FMLA issues that are in play if somebody is diagnosed with the coronavirus, because they likely will then meet the definition of a serious medical condition under the Family Medical Leave Act. Then on the ADA, as I mentioned a minute ago, the employee must be disabled that affects a major life activity significantly, such as working or breathing or something like that. In some cases, coronavirus could qualify as a disability under the ADA as amended in 2009. Again, all of these statutes are fraught with pitfalls, so you're wanting to consult with your HR rep, your in-house counsel if you're lucky enough to have in-house counsel, or your outside attorney, such as somebody like me at Farhang Medcoff. We deal with these issues day in, day out, and can provide you advice to best protect your organization. The other thing to consider, if you don't have it already, is talking to your insurance agent about purchasing employment practices liability insurance. That would provide you some protections in the event that somebody claims that you have violated their rights under federal law. Then that employment practices liability insurance policy may provide you some protection. Definitely talk to your insurance agent about a rider for wage and hour claims, because otherwise those sort of claims would not be covered under a standard EPLI policy. So you want both the rider for wage and hour claims that covers attorney's fees as well as potential settlements that you might have to pay on a wage and hour claim, especially in these difficult times if employees end up losing their job. They feel like it's because they've been discriminated against because they have the coronavirus, or you've regarded them as having the coronavirus. That's where the EPLI policy and or the wage and hour rider under that policy could provide you some protections as an employer, such that you only have to pay the deductible, and then the insurance company would be paying the defense costs and or any settlement value that you have on top of that. So that's basically the presentation I had with respect to the issues. If you guys have any questions, I'm happy to answer them to the best of my ability at this time. If you don't have any questions now, but think of questions later, you can hit me up on my firm's website at tmedcoff at fmlaw.law or farhangmedcoff.com. Either web address will work for me in terms of email to send me questions, and then I'll be happy to answer them. You could also email your any reps at the Tucson Metro Chamber. They'll be able to get those questions to me, and I'll be able to help you quickly with respect to these issues. Obviously, this is a fluid, uncharted area for employers as well as us as a community, and we at Farhang Medcoff are here to answer questions, provide guidance, and support our local businesses as best we can. Thank you for your time and watching the video. Best of luck, and we're here when you need us. Thank you much.